Yeah, so concussed patients have a lot of different types of symptoms. One of them, I think, or one group of them, I think, is coming from this autonomic nervous system dysfunction and this lack of autoregulation of blood flow. One very common one is when they report they get dizzy or lightheaded upon standing,
Yes.
not just from when they get up in the morning, but if they're lying on the couch and they get up during the day, they typically feel lightheaded. Sometimes they feel actually vertiginous, they get a sensation of motion.
Yes.
But more often it's lightheaded. And I think the lightheaded part is because they are not pumping enough blood to their concussed brain when they stand up for a few seconds, and they feel that. Now, they may also have a vestibular component to that, which they usually describe if you ask them, and the kind of little trick I use, which I learned from a physical therapist, is tell me what you mean by dizzy, but don't use the word dizzy. And so that'll force them to,
Good point.
describe it. And usually they'll say, well, I'm swaying, or I feel like things are spinning around me. And that gives you, the therapist, or the trainer or the doc, an idea that this may be a vestibular issue. In a concussion, most of the vestibular issues are central. They're not out in the the inner ear, middle ear. They're not BPPV. They're in the brainstem and the cerebellum, most likely, and with contributions from the neck. So, like many other symptom generators in concussion, there's often several sources. And as therapists, you are probably well aware that you can have cervicogenic dizziness compounding your complaints of central dizziness. So orthostatic, we call it orthostatic intolerance. It's not actually
Yeah.
orthostatic hypotension, but it's intolerance. And we see this a lot. We have a paper coming out on it, in fact, where 40 to 50% of these patients, and I think it's even more than that, frankly, but will soon after the concussion be symptomatic upon changing position. The other thing that autonomic dysregulation of blood flow presents as is symptom exacerbation with activity. And again, exercise intolerance is sort of how we got started in this business. And that is just lack of control of cerebral blood flow during exercise or physical activity that causes symptoms to develop in the concussed brain. I think another autonomic or dysregulation symptom is probably insomnia to some degree. I talked about in the talk how people have trouble switching from the appropriate branch of the autonomic nervous system, one to the other, sympathetic to parasympathetic and reverse. Well, when you're trying to sleep, you have to enter a parasympathetic state, and the concussed patients, almost to a person, can't sleep very well for a while.
Yeah.
And I think that may be autonomically mediated too. So those are some of the symptoms you'll see.